Hi, I'm Pat Kessel, and I'm a local insurance broker here in Fairfield. As one of the products that I sell family health insurance. And this time of year, as policies are being renewed, there's a lot of concern because the premiums are high, and I feel sorry. People, it's hard to make the premium payments. And I've been talking to Dee Bradley, who is a local coordinator for the Iowa Hawkeye outreach program, which provides no cost or very low cost health care coverage for children.
That's right, Pat.
Can you kind of tell me about how the program got started in the state? Is it an Iowa program, or
Yes.
It must be Hawkeye?
Hawkeye, yes, it is a Iowa program. Hawkeye stands for Healthy and Well Kids in Iowa. That means my kids, your kids, and our kids out there in Iowa.
How long has the program been around?
When I first learned of this program, it was in the fall of '99. Looking out at
a year ago,
looking out at the pharmacy, and I picked up one of the brochures and I laid it back down. I said,
this brochure here?
This brochure, what you're looking at right
Which
there.
is, I've noticed you can find these in doctor's offices and insurance offices and pharmacies, you're saying?
Pharmacies, yes, in pharmacies, schools. You can find them in convenience stores. I've been a lot of places, Pat, leaving my brochures. I work in 3 counties, Washington, Jefferson, and Keokuk counties.
For years in the state of Iowa, there's been a program. I know at one time it was called SHARE program, or Iowa SHARE, something like that, that provided low-cost health insurance to children in the state. A couple of years ago, I'm the legislative chairman for the chamber, and we put on breakfasts, and I noticed in visiting with at that time Senator Gaddings and Representative Reynolds and even Dave Miller, we started talking again about revamping that program, and I believe this is really what's come out of it.
That's right, Pat.
It's even though it's the politicians work on the program, it's not partisan, is it?
No, it is not. I would like to tell you about that. It started with, this particular program, Hawkeye, started with ex-Governor Branstad. And we had 16 counties in northern Iowa. That was a pilot project for this Hawkeye program for kids, the health insurance. And then when Governor Vilsack came on board, he looked at this program and he said, it's such a good program. Why don't we have it in all 99 counties? That's why I'm here. He has some person working in all of our 99 counties to get this program out to our kids of Iowa.
I think that's kind of what the problem was with the programs before, is that they weren't marketed, they weren't sold, not really sold, but there wasn't somebody promoting them, because there's, no commissions paid at all, correct?
That's right. That is right.
And so, salespeople, since they don't get paid, they weren't marketing it.
That's right.
And so they needed somebody like you to promote it.
Yes. Pat, I would like to tell you this. This is under the Decategorization project, which is a new entity in the state of Iowa. And I think it's been in Iowa for about a year and a half. So they fund this through one of their grants. And so I'm working off of a grant. I started in January of this year, but we ran out of money at the end of April and wouldn't have any more money until July 1st. That did not stop me from working May and June. I worked just as hard as I worked January, February, March, and April.
I know I'd see you in the office bringing in brochures for us, or visiting with people. Can you tell, what does Hawkeye do? What is it? Does it provide insurance for the whole family?
No, it doesn't, Pat. It covers insurance for children 0 to 19. Once the child hits 19, they cannot be on the program.
Even if they're in college or still a dependent?
No.
It just plain stops when they're 19?
If your child is 19 and perhaps maybe almost through high school, which would be a senior, they cannot be on the program.
Okay. Is the insurance any good? What does it cover?
Oh, it's the best insurance, and a lot of people always ask me that. And it covers 100% doctor visits.
No deductibles?
No deductibles. Can I talk about the income just for a minute on this?
Well, sure.
Okay,
Yeah.
all right. And Pat told you that it would be no income or low income. If you meet the income guidelines, we have two charts that we go by. We go by what we call the blue chart, and then we go by the yellow chart. If your income falls within the blue chart, there is no premium due. If your income falls within the yellow chart, and Pat, I always like to use me as an example.
All right.
All right?
Okay.
All right. I have 4 children, my husband and I. So I would have a family size of 6.
Okay.
And you can see
so in
how-
the family size, you don't just count your children, you count mom and dad both in there.
Right.
Okay.
You can count mom and dad and brother that's 19 and another brother 20 if they're still living in the home.
What if you have grandma living there too?
Well, I don't know about grandma.
Oh, okay.
I've never gotten into that, okay? All right. Now
Okay,
here
mom
we
and
go.
dad and kids.
Mom and dad and kids. And I can make up to $45,700, my total, for my 4 children and my husband and I. But Pat, hypothetically, I make $55,000. And you're going to tell me, Dee, you can't be on the program. You can't have your kids on the program. Yes, I can. Because in the front of the brochure, it will tell you that you can take 20% off of your earned income. So if I took 20% off of $55,000, I'm going to be back within the income guidelines.
That'd be $11,000 you'd take off.
Right. See, I'm going to be back within that. I'm going to be back within that range. And a lot of people don't realize that. Well, you got to remember to take off 20% of the earned income. And Pat, for my 4 kids now, not $10 a child, but $20 total for my 4 children.
Oh, they cap it. It's
They
not
cap
10.
it. No.
So if you pay, it's $10 a child, but they cap it at 2 children.
$20.
So
$20 is all you're going to pay. So for my $20, and I'm on the program, this is what I'm going to get.
okay.
All of my doctor visits will be covered for all of my 4 children. Outpatient, inpatient hospital services.
That means like if you have to go in for tests and leave the same day, that's outpatient.
That's
but
outpatient.
Or they admit you because you have to have your appendix out or
Yes,
something.
yes.
And again, that's no deductible or copayments,
No
right?
deductible, no copayment, no.
Okay. How about medicines?
Prescription medicines, yes, it's fully covered, 100%. Now I might say this, you know, a lot of our drug industry is making new drugs nowadays. They come up with something new every once in a while.
Oh, yes, they do.
So maybe perhaps when a family sends or the pharmacist sends in the drug bill and it comes back and it said, we can't pay that because we don't have that. It's so new, the drug is so new that it's not in the program yet for Hawkeye. Does that stop the family from not having that bill paid? No. They write a letter and they say, my doctor says that I need this prescription. The pharmacist signs it and he sends it in. It will be paid. It will be paid.
And if they have any problems or questions, they can always call you,
They
too,
can
right?
always call me. I'm always
I notice
available.
you have your home phone number and an office,
Yes.
which is the public health office, right on
Yes.
every brochure.
Yes, I
So
do.
easy to find.
Yes, I am.
So it also covers, it looks like, well child care,
Yes.
vaccination shots.
Yes.
It covers eyeglasses and exams.
They will pay up to $100 for eyeglasses. So if one of my children decided, hey, Mom, I want that pair of glasses that cost $200, they'll only pay the $100.
Okay.
So somebody has to come
But then
up
they
with the
pay
other
for all the
100.
exam
All
in
the
addition
exams.
to that. It's just,
Yes,
yeah.
right. An ophthalmologist or an optometrist.
In addition to that, it covers dental care.
All dental care except braces.
Okay.
Braces is cosmetic, so they don't cover the braces.
Hospice services,
Mm-hmm.
speech therapy, physical therapy, ambulance, nursing care, and durable medical equipment. It also covers any hearing tests or services.
Hearing tests, they will also pay for the hearing aids.
It covers mental health care and
Yes.
substance abuse
Yes.
and chiropractic.
Yes.
This
And-
is a very good plan.
Yes, it is. And Pat, do you know how children are sometimes? They can get sick 2 times a week. Okay, you all know. We all know this. And we go at the doctor. This plan will pay no matter how many times you go to the doctor. And the way the doctor gets paid, they send the bill in directly to Hawkeye. The money comes back to the doctors.
So that people don't have to fool around with forms, because I know that
No.
most of my clients hate fooling
They
around
hate
with
forms, right. So the doctor does that, or the doctor's office. The pharmacy sends it in. The optometrist sends it in. So the people that have taken out Hawkeye do not see any
Can they go
bills.
to whatever doctor they want, or is there a list?
There is a list. Once the person gets on, they get a list of the medical doctors in their area.
That are part of this Hawkeye program?
Yes, they have to participate in it. They have to call. They have to get on the program. And I might say this, when you're on the Hawkeye program, and if your physician sends you to Iowa City, Des Moines, Ottumwa, or anywhere else in the state of Iowa, you want to make sure that you're going to a participating provider. Because if not, you will have to pay the bill, not Hawkeye.
In Fairfield, in Jefferson County, the doctors, most of them?
Yeah, all of our doctors.
That's
I'm
good to
proud
hear.
to say all of our doctors in Jefferson County are covered. Our hospital is covered. Our chiropractors are covered.
That's really nice.
We're all covered in the county, yes.
How about like in Iowa City University hospitals? Are they participating in this program?
Yes, yes. As an outreach worker, that I'm sitting here as a coordinator, I have the list of all doctors in the state of Iowa. It covers all the ones in Iowa City.
At the university?
At the university.
Right.
Well, all of
Oh, really?
all of the doctors that are participating, yes. Not just the doctors at the university or Mercy.
Okay.
I have them all in my book.
Okay, great. So it's not only is it very comprehensive in what it covers and provides to our children, but it also is very comprehensive really in scope in as far as the medical care community that are participating
Yes,
and
yes.
seeing this as a valuable.
Yes. I've talked to many doctors in the hospitals. They like this program very much. It's well worth it. And you know, when we keep our kids healthy, they're better students. They'll grow up to be better adults.
Do they have to fill out a lot of papers to get involved in this?
No, they really don't. We have one application that we fill out. It's in the brochure that I'm holding, and I'm going to take out my envelope. It's real simple. It's an 8.5 by 14, 2 pages, very, very easy to fill out. I too, Pat, help people fill out.
And you'll
the
go
app.
and help them fill it
I
out.
will
if you,
go and help them fill it out. Yes, I will be glad to go. That's one of my jobs. If they have any questions they want to ask, call
Or
me.
they can have it, really just anybody help them if they're having a struggle with it.
Anybody.
They can take it into their own insurance agent. I'm
That's
sure
right,
that, I know,
right.
I would be glad to help somebody
Yes.
fill this form out. It is very simple.
Yes.
There's no health questions, is there?
There's no health questions. That
It-
brings up
it's-
a good thing,
yeah.
Pat. There's no health questions. And I want to tell you this. If a family has a child that's handicapped,
Right.
and will be handicapped for several months, years, this Iowa Hawkeye program takes that child. No questions asked. None whatsoever.
And no questions asked for anybody, not just that.
No questions
So
asked.
really the only questions are name and address and your kids' names and their birth dates, their social security number, and then really basically from then on it has to do with income.
Income, yes.
Because the program is based on income. It's not based on your health.
Right. And you know how, Pat, we guard our social security number very carefully now. I do, and I know you do. You probably
They
don't
should.
even have it on your driver's license. But here it says it's optional
You
to give out your social security number. I tell people not to put it on. Don't put your social security number on as an adult.
Oh, really?
Yeah. State of Iowa's not interested in you. We're interested in the child.
Okay.
And they also don't have to list their child's social security number. That's up to them. It's optional. Very optional. And Pat, you know, we have this for the Hispanics also.
Yeah, I noticed that there was a page down here I couldn't read, so I assumed it was some foreign language.
Yes.
It's in Spanish.
Yes.
And it basically says the same thing as the brochure.
Same thing.
It explains the program quickly. Again, it's a simple program. It's free or no-cost insurance for children 0 to 19, and there's a low-cost insurance for families that make a little more money. I noticed you can make up to $57,300, and if you had 8 members of the family, so that would be mom and dad and 6 children, and some of the kids can be over 19 involved in this calculation.
Yes, they can.
As long as they're living at home.
That's right.
But only the ones that are under 19 would be covered.
Right. That is right.
And so actually you could be making into the $60,000-$70,000 almost income range,
yes, and
could. Because of the 20%
yes,
that you
could
deduct off of
That's
that.
Right.
So,
you better believe it.
You would cap at a total of just $20 is all you would pay for your children.
You know what I talk about, Pat, when I do presentations, I tell them that we are the hardworking poor people. We're hardworking. We're all hardworking or we wouldn't be out here working. And they're the people that have kids. They put a roof over their head. They feed them, they clothe them. And times have changed from way back when. It's hard to provide health coverage for your children.
Which is really a basic need in life.
Yes, it is.
To provide quality health care.
That's right.
You were talking to me earlier that there was something about a 5% rule that you were sharing with me.
Yes, I shared that with you, Pat. And the reason is because I have been telling people about it in my presentations.
Yes?
It's not in the brochure. It's like if a family is paying 5% of their income per month for health coverage for their kids, they may go directly onto Hawkeye, onto this fabulous program.
5% or more.
5% or more.
Now, does that take that 20? Do you take that 20% off of that too?
Yes, we do, Pat.
So if a family is making $2,000 a month and they're paying 5% of that, or $100, they might, for their children, they might be able to go onto this for $10 or $20 or free.
Remember now, if they qualify under the income.
Right. Well, they would.
Yes, they would.
That number.
Yes.
And so, really, if you took $2,500 a month and 20% off of that, which would be $2,000, so you could hit the 5% and qualify to fit under this.
Yes, you could.
Okay.
We are getting families on this, Pat, under the 5% rule. Some people will call me and I'll say to them, let's look at your income. Bring me, what I need to talk with you about is your previous month's income.
Okay.
I can use, like, this is the month of December. So I will be looking at people next week that have incomes during the month of November. And we'll sit down.
You just look at 1 month's income?
Yes, I can look at just 1 month income. And I say 12 times that, because we have 12 months in a year. Don't forget to take off your 20%, because you have a month's income times 12 less 20%. That gives you your total of earned income per year.
Okay.
But there's another avenue also. We can look at your 99 income tax return. I can still look at that because we're still in the month of December. Excuse me. Yeah, 99. That's right, 99. Okay. And I can look at that and look at your gross income. I will take 20% off the top to see if you would qualify under the income guidelines. Sometimes it's easier to look at monthly incomes. Do you know why, Pat? Because a lot of people change. Monthly incomes change. Let's see, there's construction workers out here. We have some factory workers that don't work sometimes during the winter.
Seasonal layoffs.
Seasonal layoffs. So if we can hit a month that they can qualify, then we can get them on Hawkeye.
For their children.
For their children, yes. That's right. Everyone in the city of Fairfield, Jefferson County, I can say this honestly in all 3 of my counties, have been very supportive of this. And like we talked about, Pat, we're working off of a grant that we get. It's such a low grant that it doesn't run very long. Come July 1 this last year, we received another small grant for this, and they decided that I could work 1 day a week. But I can't get anything done in 1 day a week. I can't do justice to the program. So of course I work more hours. In October, I heard a rumor that Jefferson County, Washington County, and Kitsap County was going to be awarded another grant from the federal Rural Health Grant.
Okay.
We got that, Pat. It went into effect December 1st, which means I'll be out there plugging away about 4 days a week for a while, and I'll be glad to do that.
Great. Well, again, if anybody has a question about this Hawkeye Healthy Kids in Iowa program, you can get a hold of the Hawkeye Outreach Coordinator, Dee Bradley, at her home or office, and which is the Public Health Office. Is it okay if I give your phone number
You
on there?
certainly can. You certainly can.
It's 641-472-2550 or 641-472-5929. And if you can't remember those numbers, if you want to call me, I'll tell you how to get a hold of Dee. It's for no-cost or low-cost health insurance for children age 0 to 19. Very comprehensive in its coverage and very easy to deal with paperwork-wise, not only signing up for the plan, but also afterwards, because doctors are participating in this area. And it's based on income and family size, and the income is up there to where it can help many people.
Yes.
Even if you have to pay $10 per child or $20 total for all your children, it's a steal. It's a bargain. And so, thanks, Dee, for.
Yes, thank you very much, Pat. And I know Farm Bureau stands behind me. They work with me 100%. Thank you again.
You're welcome.